My audience. Okay, I'm passing the camera off. Okay, so imagine you're at the hospital and your nurse walks into the room and says the doctor ordered blood work and intravenous catheter. What's going through your head? Are you terrified of needles? Does the thought of needles make you want to cringe? Most of you will receive an intravenous catheter at some point in your life. For most people, the fear of the unknown is the scary part. So today, after listening to my speech, you will not only learn about the implications and reasons for IV insertion, you will learn the step-by-step process as well, and your fears of the unknown will be subsided. Today you will learn about the implications and reasons for IV insertion, the step-by-step process of inserting an IV, and the care of an IV after it's inserted. So to begin with, we will talk about why you might receive an IV. People come into the hospital for many reasons, whether it be headache, nausea, vomiting, high blood pressure, stroke-like symptoms, chest pain. The reasons are endless. So according to the National Institute of Health, blood tests show whether the level of different substances in the blood fall within a normal range. So in order for a physician to diagnose you properly, they need to get this blood. Sometimes blood needs to be collected multiple times during a hospital stay. For instance, if you come in with chest pain or shortness of breath, a physician will need to collect cardiac enzymes 2 times, usually separated by 2 hours. So to prevent sticking the patient more than 1 time, we'll leave an IV catheter in place so that we can draw blood on numerous occasions. According to the Mayo Clinic, certain heart enzymes slowly leak out into your bloodstream if the heart has been injured by a heart attack. So you would expect that these heart enzymes would rise as time passes, and that's the reason why we have to collect blood on numerous occasions. Another example of that same situation would be in a patient with severe dehydration. A lot of times with dehydration, your creatinine level is an indicator of kidney function, which that number rises when you're dehydrated. So a physician will typically give you IV fluids and then redraw that creatinine level and check kidney function. If the levels have lowered or improved, then typically you will be discharged to go home. Another reason why we want IV access is for medication and fluid administration. So for a patient, for instance, who is nauseous and vomiting, can't keep any food down, we would want to give them fluids and some antiemetics or anti-nausea medications because they can't take anything by mouth. Another example would be if a patient comes in with severe low potassium, it can be really dangerous to the heart. So in that instance, we want to get the level up in a quick manner, and the best way to do that is through IV potassium administration. So now that you know some of the reasons why we might administer or why we might need to insert an IV catheter, we're going to go through the step-by-step procedure of how to insert an IV. I'm not actually going to insert the IV, but I'm going to use just an example, the setup of what we might need to do. So, first of all, you need to assemble your equipment. You want to make sure that you've got a tourniquet, the proper needle size, a cleaning prep, the tubing, as well as a vacutainer. This is attached to the end here, and you would typically have blood tubes that you would insert once you insert the IV. So according to the University of Ottawa website, it's important to perform IV sticks from distal to proximal. That means from bottom to top. If you say, for instance, you insert an IV up here and then the vein blows, then you decide, okay, I'll go ahead and insert one lower. Well, the fluid or medication that you might administer might leak out into the tissue, and it may not be fully absorbed into the body like it should be through a vein. So you typically want to start lower and go higher, but in an emergency setting where I work, we're going to go with whatever we can find quickest, which generally is in the antecubital space or the elbow area. So you start by putting your tourniquet on. You're going to put it tight. It's a little uncomfortable. Sorry, Kelly. Okay. So you drop the arm down. You want to find a good vein. So I found my vein here. I'm not going to insert the IV, but you're going to put on gloves, cleanse the area. And once I found my spot, I would take the needle, bevel up, insert it into the vein. Once you get a flash of blood, the catheter goes into the vein and the needle actually comes out. So this is inside the patient. The tourniquet comes off. The tubing is applied. And blood tubes are inserted. So collect the blood. And then you're going to take that off. You'll flush it to make sure all the blood is out of the tubing. And then you're going to dress your catheter with a tegaderm, is what this is called, and some tape. Not that scary, right? So, once this is on, the next step to know is, what do I do after I have a catheter? So if you're lucky enough to be discharged from the hospital, you don't have to worry about aftercare. But if you have to stay overnight or for an extended period of time, you do need to know what to look for. So in our hospital, there is no timeline. You can leave the catheter in as long as it's actually working. But if the dressing becomes soiled or if it starts to become loose, you're going to want to change it, cleanse it, and redress it. Now, as a patient, you want to know if the area gets red, if it's painful, if there's any swelling. You're going to want to notify your nurse, and that way they can take out the IV, because it may be out of the vein and into the tissue at that point, and that could be harmful. So they're going to take out the IV and they're going to reinsert. So to take off, it's pretty simple. And this would come right out of the vein. And you would dress it with a little pressure dressing and some tape. You can leave the dressing on for about 10 minutes and then a Band-Aid after 10 minutes. So, like I said before, most of you will receive an IV at some point in your life. The fear of the unknown typically is the scary part. But now that you've learned about why you might need an IV, the step-by-step process of how to insert the IV, and the care after the IV, your fear should be subsided. So now, again, think about a nurse coming into your room and telling you, I'm going to need some blood work, and the doctor ordered intravenous catheter. Now, let me guess what you're thinking. I've got this.